American people. Thanks. Third row, thanks.
The judiciary can only continue its full paid operation through Friday. Do you have any concerns about what will happen with that, criminal and civil cases?
We remain completely and totally concerned by all of the aspects of the Trump Republican shutdown, which is why we need them to abandon their failed my way or the highway approach, their take it or leave it approach, and the Republican go it alone approach. Because if Democratic votes are needed to reopen the government, which is the case, then this has to be a bipartisan discussion to find a bipartisan resolution to reopen the government and address the Republican health care crisis. We are very concerned with all of the implications of this Trump Republican shutdown and how the American people are being hurt. It doesn't seem to me that Republicans are concerned because they remain on vacation and have now canceled votes for the third consecutive week. That's outrageous. Democrats from all across the country will be here in person, meeting in just a few hours and throughout the week because we want to reopen the government. And the question has to be asked, why in the world are House Republicans still on vacation, spread out across the country and the world? It's perplexing. It's shocking. I'm flummoxed by the whole situation. It makes no sense. They're reinforcing the narrative that they could care less about the quality of life of the American people.
Leader Jeffries.
Thanks.
Mr. Leader, I want to ask you about November 1st, which is when open enrollment begins, as you know, and some rates are already being set. There are some who think that's a date by which, at this point, the leverage of the shutdown may not matter as much because the ACA subsidies will be in motion in terms of the rates. How do you feel about that idea?
Well, our view has always been that we have to address the Republican healthcare crisis and the need to extend the Affordable Care Act tax credits with the fierce urgency of now, because at this moment in time, notices are going out to people all across the country indicating that their premiums, copays, and deductibles are about to skyrocket. People are about to pay thousands of dollars more per year. And for many hardworking American taxpayers, you're talking about their health insurance rates doubling, tripling, or quadrupling. In the congressional district that Speaker Johnson represents, you're talking about thousands of people in his district who are about to experience a 379% premium increase. How is that acceptable? That's happening right now. One of the reasons why we have to act right now is because of the November 1st open enrollment period. That's just the beginning of the open enrollment period. It'll last until early to mid-December. And so Republicans can try to run away from this problem that they've created by continuing to break our healthcare system, but they will not be able to hide. And that will become increasingly clear, as Marjorie Taylor Greene consistently has pointed out, in the weeks to come.
Leader Jeffries.
Thanks. You got it. Yep. Michael?
You mentioned